Go.
Good afternoon. How are you doing today,
Good,
Jerry?
how are you?
I'm good. My name's Isaiah. I'll be your student PT today. So we're going to be doing a little bit of kind of a pulmonary screening. We're going to be listening to your lung sounds, and then I'll show you a breathing technique that we can use to help you out, and then we'll also do a little bit of airway clearance, see if we can get some gunk out of your system. Does that sound okay?
Yeah, sounds like a plan.
Awesome. I'm going to have to be kind of touching your shoulders, back, and things while I'm checking those heart sounds. And then we will also be doing this directly on the skin if you're comfortable with that. That would be the best way to be able to hear your lungs properly. Is that okay with you?
Yeah, it's fine.
Awesome. So I'll have you remove that shirt, and we'll be doing a lung auscultation here. So we want to be doing 4 spots on the front and the back, just looking for normal kind of breezy, whooshing sounds, and then also looking out for crackles or any wheezing that could show any consolidation going on in the lungs. Okay, Jared, so I'm going to have you breathe in and out through your mouth and just stay nice and tall and relaxed and just breathe normally, just through the mouth though for me. Okay? All right. So we'll start with the apex here. Go ahead, deep breath. Good. Perfect. We'll move here to the upper lobes. Good. And now the middle lobes. Perfect. And now we'll hit the lower lobes here on the front. Perfect. Okay, and Jared, we're just going to do the same thing on the back now. Starting with the apex again. Breathe in and out through your mouth. Good. Okay, now the upper lobes. Good. Perfect. Now middle lobes. Good. Okay, and finally the lower lobes, one more time. Perfect. Okay, excellent job, Jared. So we found normal lung sounds everywhere except for the right middle lobe. So we'll check that for consolidation. And that is lung auscultation.
All right, go ahead.
Okay, Jared. So we're going to go through a little bit of a breathing technique that I think can help you out of it. It's going to be called purse-lip breathing. So essentially the way that is going to work is you're going to breathe in slowly through the nose for 2 seconds. And I want you to just purse your lips or make kind of an O with your lips on the exhale, and then you're just going to slowly exhale for 4 seconds.
Sure.
Okay? Okay, so we'll start there. So let me see, breathe in for 2 seconds. Good. And for 4. Nice and easy. Good. Okay, and one more time. Perfect. And this is going to help you basically be able to kind of prolong how long you're able to expire air out of your lungs.
Sure.
And then it'll also kind of help with decreased stress and things like that too. So it's a good breathing technique, but also a good relaxation technique as well. Okay?
Awesome.
So the next thing that I'm going to show you is a huff cough. Have you heard of a huff cough before?
I've heard it before, but I don't really know what it is.
Okay. So a huff cough is essentially a way to clear out your airways without putting as much stress or tension on your chest wall and just your pulmonary system in general. So people typically do kind of a hard kind of K cough, like, and that's puts a lot of pressure and can add chest pain if you're having it as well. So a huff cough is really going to be more of like an H sound, almost like you're fogging up a mirror. So it's going to be more something like this. Okay. So I want you to focus on that. Try not to cough super hard or with your chest. I want you to just fog up the mirror and try to push out some of that gum. So we'll use this tissue here. I just want you to do that pursed lip breathing we just did. So in through the nose for 2 and out through an O with your mouth for 4. And at the end of that exhale, I want you to do a huff cough into your tissue.
Sure.
Okay? Got it? Okay, so go in for 2. Good. Out for 4. And huff cough at the end. Perfect. Perfect. All right. And that is pursed lip breathing and a huff cough.
And go.
Okay, we're going to be doing a little bit of airway clearance here with Jared. We found a little bit of gunk and consolidation in that right middle lobe while we were auscultating. So we're going to be using percussion today for this right middle lobe of the lung. Essentially, you want your patient set up here on their left side. We want to establish a bit of a Trendelenburg position, tipped down so that we can funnel that gunk and things down and out of his system. So we're going to cup the hands and then just do some taps and hits right here over the right middle lobe. Jared, I want you to just let me know if the tapping and the pressure feels okay. Let me know if you feel any discomfort.
Sure.
And then we also have our patient here with their tissue, and they'll be intermittently doing huff coughs when they can feel some of that consolidation starting to come out of their system. So Jared, that'll be on your own time. I just want you to do those intermittently when you feel like it's necessary. Sound good?
Yep. Sounds
Okay.
like a plan.
Keep me updated on how you're feeling. For general postural drainage, we do 10 minutes. For actual percussion, we typically do 3 to 5 minutes here in this position. For video's sake, we'll do 30 seconds. Okay, you ready?
Yep.
All right, nice and relaxed, easy breaths. We'll go another 10 seconds here. If you need to do one more huff cough, Jared, feel free. Good. Okay. And that would be percussion on the right middle lobe.